Hi, everyone. Welcome back to the channel. I'm Veronica, the founder of Good Grief, and today we have a really special guest. We're joined by Jessie Hazelwood, a registered nurse with over 20 years of clinical experience and the founder of Bluebird Local Nursing, a concierge nursing service based here in Austin. Through Bluebird, Jessie and her team provide personalized one-on-one nursing care in the home, supporting families with everything from post-op recovery to medication management to coordinating with doctors and advocating for patients through complex care decisions. If you've ever found yourself wondering what your options are when a loved one needs care at home, or how to even begin navigating that system, then this session is for you. Whether you're in the thick of caregiving right now or just trying to plan ahead, Jessie is here to bring real clarity to what can feel like an incredibly overwhelming and fragmented process. Jessie, thank you so much for being here.
Thanks, Veronica. Can you hear me okay?
Yes.
Okay, great. I very much appreciate you helping me today to do this. I have been running my company since 2021, and I've been out there seeing patients. I saw a patient today. And so my public speaking has not been very used yet. I did one city council meeting and I got a grumpy old council member. So but this is really great. I've worked on my PowerPoint skills and I did a little bit of practicing, so I'll try not to and ah too much for you guys. All right, let me share my screen and I'm going to share my second screen. Okay, does that look good?
Yes, it does. We can see it.
Okay, and okay, so my company is called Bluebird Local Nursing. I most recently was in home health. Um, my really great skill is wound care. Home health does a lot of wounds and incisions. I did Medicare home health for a while and I was kind of going up the ladder but I remember a patient calling me and asking me if his nurse was going to come today, and I honestly didn't know, and that was upsetting for me. And so I went into private nursing, and that's just been such a joy to really spend as much time as my patient needs and be one-on-one and not have five call lights going off. And so I've really enjoyed this, and I have been helping nurses come back to the bedside who've left nursing because of the system and the burnout that can occur, especially under insurance and federal programs. With that note, I will try not to be super jaded nurse, which I tend to do sometimes. So, okay, let's see. Let me go to the net. Let me move this so I can see my notes a little bit better. Like Veronica said, I've done ICU, home health, home infusion, clinical research, pharmaceutical trials. And so I've kind of seen it all, jack of all trades, really. Okay, let's first talk about why somebody needs home care. So there's either an acute illness that's happening, or it's just general aging and all the things that go along with that. The biggest, of course, is debility. So we're talking about mobility throughout the house, fall risks. One of the primary reasons people end up moving into a facility is because of toileting. Um, Home health can come in and really show you the safest way to be in your home and how to transfer, how to use a bedside commode, how to use different types of equipment that will help with the toileting so that it's safer and easier and less messy. Um, Also, bathing, dressing, food preparation, transportation to and from appointments. If you're using a wheelchair or you even need a stretcher, an ambulance, there's a lot of different things that can happen depending on what it is that you're dealing with. The cool new thing with someone living home alone and risk for falls is these pendants. I'm sure you remember the I've fallen and I can't get up lady. There's videos you can use, baby monitors. A lot of those pendants now have accelerometers in them, so when a person falls, it actually triggers it to go off. So there is a lot of new tech that's coming out that's helping people to age in place. Cognitive decline, that's a whole other issue that can become very, very complicated. And if somebody's dealing with that particular, I'm happy to talk to you at length about that afterwards. Self-neglect, safety issues, leaving things on the stove, starting fires, falling and no one knows that you've fallen for days. Um, Medication errors, particularly with dementia, dehydration, poor nutrition, they're not eating, they're not drinking, or they're just having cookies and coffee. We get muscle wasting, and that just is a vicious cycle with the mobility. Being alone and being sick, pain, isolation, depression, anxiety, and especially if you've had prior substance abuse issues, those can really be exacerbated. Smoking, drinking, all the things that people deal with when they're not sick. Those things can become worse. Complex medical management. Uh, I'm going to talk about this on a later slide, but making sure you get to all of your appointments, making sure you saw the right doctors for what it is that you need, different medications. If you can't reach the spot, creams, eye drops, high risk meds like blood thinners that if you fall can cause a real problem, chemo drugs that need to be handled a certain way, and then any type of tube or IV. Ostomies, wounds, IV lines, ports, trachs. This is a lot of times where we get calls. All right, next slide. This is I love this picture because this is really what. Oh, I'm sorry, I skipped ahead. Patients' rights. Like I said, there has been a lot of cuts to Medicare. The hospitals are dealing with staffing issues since the pandemic. A lot of nurses have left the bedside. I'm sure you guys have heard of these problems. It's consuming a lot of our politics these days. That being said, you must advocate for yourself or your person. Trusting the healthcare system to know what your allergies are, know what you need next. Even the most prudent doctors make mistakes. It's really great if you can have your med list with you and your allergies and you're on top of it and you know what's happening. Somebody with dementia goes to the doctor's office. Well, did they make your appointment? Oh, I don't know. The nowadays you have to get into these portals. I called an oncologist the other day and they would not give me the results over the phone. I had to log into the portal and just, dealing with 95-year-old people all day that need to log into a portal. They may not even have a computer or a tablet. And it's very frustrating to me to see that this is what our seniors are having to deal with just to get healthcare. Um, This is particularly a problem when you're feeling sick and having, loss of control. Um, so you make sure that you're fully informed before you decide what particular decisions, medications, treatments, etc. You have the right to refuse anything. If you are in a hospital and you decide to leave the hospital and they tell you that your insurance won't cover it if you leave the hospital, that is an absolute lie. And don't believe that. It is your right to do whatever you need to do at that moment. Um, okay, let's see here. So because of this, there's been a bit of an emerging market. Healthcare is really moving to private pay. People are cutting out healthcare. They're cutting out Medicare. They're cutting out private insurance. Concierge care, that sounds very froofy and expensive, but really it should just be called cash pay. A lot of doctors are leaving their practices, starting concierge care. They charge a monthly service. They promise to only take 1,000 patients. They're available by text. They're fantastic. You're on vacation, you need an antibiotic for a UTI, done. You don't need to get an appointment. You've got a chronic condition, they know you. They know what you need. The greatest thing that's happening in this space is these doctors are going right to the hospital, right to the labs, and right to the radiology, and negotiating lower prices for Americans, and that is awesome. And I'm really excited about that particular thing happening, innovation. Um, if I had to run for president today, my platform would be public health for everyone, like the VA. It's probably not the greatest. It's kind of slow. It's cumbersome. But then, in addition to that, this is how it is in England. There's also a private system. If you want better, bigger, better, faster now, you can pay for that. I just talked to a woman yesterday in Canada who is waiting and waiting and waiting in horrible pain for a gallbladder surgery. And this is why a lot of Canadians come to the US for medical care because they can get it right away. Um, okay, this is a picture. This is so typical. I walk into a patient's house and this is their medicines. It's just chaos. Um, when you get diagnosed with something, it's, often unexpected. It's so good to be organized, have your medication list, bring it with you to each appointment, keep it updated, know what appointments you've got coming. I work triage at a primary care doctor, and if you run out of pills, a lot of these doctors, you have to get an appointment before they'll refill your meds. So these young kids with ADHD and their depression medication, they'd be out for weeks because they had to get in and they had to wait. And you should have a primary care doctor. If you go to a specialist and let's say you have a surgery, but then you develop sort of like a chronic constipation after that the surgeon's going to be like, well, go to your primary care doctor. Often in home health, we see patients that have come home from surgery. They don't have a primary care doctor. So now we're scrambling to get them an appointment with a primary care so that they can get the referrals that they need and the home health that they need. It's all based off of this physician referral. Of course, you can go to urgent care and you can go to the emergency room to get things treated right away, but it's best to have, your complex network of doctors that are treating all of your issues. Um, but it is very siloed, of course. We all know that. Um, Also, there's a lot of scamming of seniors that happens. Getting them to block people on their phone, not answering their phone. Oh, drive me crazy. Um, okay. Let's see here. Okay, so levels of care. So you need help. You can't do it yourself. Best advocate is going to be your family and your friends who care for you and they want you to have a positive outcome. A neighbor, a friend that can come over and give you your shot or whatever it is your best bet. Sometimes you can pay your neighbor to help you. Um, or a neighbor that lives next to your mom. Insurance through Medicare, primarily Medicare. There is some home health that's covered through private insurance, but it's pretty limited. A lot of it is maternity. After you've had a baby, you might get a nurse come to your house for like lactation consultant. Um, but primarily it's for people over 65 through Medicare or a Medicare replacement plan, which I do not recommend. They are very limited. You'll get, let's say you've had a surgery, a nurse will come, kind of talk to you about your meds, talk about post-op care, talk about not getting constipated on these pain pills, how to stay safe at home. You might get some limited physical therapy, occupational therapy. We used to get home health aides, but that is pretty much gone. I haven't seen that in a long time. Hospice is also covered by Medicare, and I'll talk about hospice a little bit later. Paid caregivers. So you're talking lower wage workers who might have worked in nursing homes or hospitals and cared for their own family, and you're paying them to come in maybe for 4 hours at a time, doing bathing, dressing, feeding. They might do medical reminders, but they're rarely going to do any hard skills. Certain things you wouldn't think are skilled, like eye drops and creams, those are considered medication administration. So they can fall under a lot of regulatory if you're using agency caregivers. I'm going to talk about this in a minute, versus somebody that you hire directly. And then finally, paid professionals. It depends on where you live, of course, but you can get private nurses, private doctors, private therapists. Um, what do you call those people at the gym? Personal trainers. There's a lot of options. Okay, this is my little chart. Now, this is subjective, and obviously I'm biased, and I think private nursing is the best. But um, let's start at the top here. So, self or family care, obviously the quality is going to be good if you want this person to have a good outcome, but you might be burnout. You might be the wife of someone and you're dealing with your own health issues and you're not very familiar with medical stuff and it's hard for you to keep up. Your husband has dementia, a variety of things. In Texas, I'm aware of Medicaid caregivers. It's through the DADS program, and you have to be very, very poor to qualify for this program. And I will say the quality is not great. You have issues with neglect, exploitation, theft. But if it's all you can get, this might be the best way to go. Um, Medicare insurance, home health, we talked about that a little bit. Um, Oftentimes, the quality really depends on the person walking through the door. Do they care? Are they knowledgeable? And if they're not, it's okay to ask for someone else, and it's okay to ask for that person not to come back again. And the company will let you know if they may not have anyone, so you might go with a different company. That's totally fine. It's your choice. Hospice is covered mostly through Medicare. I don't know that much about hospice for people under 65, but I know insurance and there's some different things about getting on disability and then qualifying for hospice. I personally, in my world, mostly deal with geriatrics. Um, Again, some hospice nurses are angels from heaven and you'll love them, but they are limited. They may only come 2 times a week. Some of them have a little more aggressive programs where they'll come for longer periods of time. A lot of them offer bathing, somebody to come and do bathing. The main reason I use hospice is for the medications that we need when someone is dying so that they do not suffer. They also provide one great thing about hospice is they provide hospital beds, incontinence pads, it pays for medications, and so it can really reduce the cost burden on the family. And you can just use hospice for that particular thing. The trick with hospice is um, you have to kind of say that you're not going to go to the hospital again. And if you are going to go to the hospital, then they can like kind of kick you off of hospice. But you can graduate from hospice. You went on hospice, you recovered from the acute issue. You can get off of hospice. I will say this, a dirty little secret about hospice and home health. Home health episodes pay $2,000 to $3,000. Hospice pays $6,000. If you notice, most home health agencies also have a hospice, and they have these programs that are geared towards pushing you into hospice. So just be aware that if you feel like you're being pressured to go to hospice, it might be a financial reason. Okay, direct hire. So I talked about this a little bit. Hiring someone directly. You can hire your neighbor any day to come over and change your ostomy bag. You can hire caregivers who have experience. You are the employer, so you might have to think about taxes and insurance and things like that. But there are companies out there that do staffing and they'll arrange all this for you and take care of the payroll and everything. Agency caregivers, like I said, managed by the state here in Texas and most states. They are very limited. One of the stories I can think of is a lady needed, her housekeeper left for the week and she needed her laundry done. And the agency said, oh, well, we're going to have to send out a supervisor and redo your evaluation and add laundry to the care plan. And then, by the time that all happened, the housekeeper was back. It's the bureaucracy and the slow gears of turning. like the eye drops. Nurses have to measure out in little pipettes the eye drops so that the caregivers can give it. It's just, it makes me crazy. So I prefer direct hire caregivers. The other great thing about direct hire caregivers is they can do tube feedings. And this is something that's a real barrier for people when they want to stay at home. Um, okay, let's see, care managers. So traditionally, private nursing really is kind of a newer thing. Um, but traditionally, care managers have been around for a long time. They do a lot of the legal work. So they're going to set up your DNR, your living will, your trust, perhaps. They're great if you have a son with schizophrenia and you want them to just set up his apartment, pay all his bills, and take him to all of his appointments. Like they will do that. They will find a caregiving agency for you. They will hire the caregivers and sort of manage the caregivers for you. They literally are managers. Now, there's a lot of innovation and nuance going on. Veronica's company, for example, is a really great affordable option to have someone who's non-clinical but familiar with healthcare to go and run these errands for you and call this insurance company and interview these caregivers and just the day-to-day work. You're a busy sandwich generation mom. You're dealing with your parents, you're dealing with your kids. You can't. So it's best to hire somebody, see if somebody can help you with this. And then finally, private nursing. We are full custom care. I have a lady that I saw for cancer and she has bipolar 2. She has a very difficult time getting on the phone, getting on her portals. And at this point, I am literally helping her open her mail and decide which things she needs to address and helping her pay her taxes and stuff like that. So it's sort of turned into a personal assistant. But she's older and she has health issues, so we stay on top of her appointments. Anytime she has a medical issue, we're buzzing over to her house. Um, we have about 40 nurses here in Austin, so we have a good network of response time if something's going on. And then I mostly market to 50-year-old women because we're the ones that need this service. You know, you're working, you've got a career, and you just need some help. And you may not be medical at all. And we all know how frustrating we can get with our parents too, when they're just not as sharp as they used to be. And you expect that your mom, you know, she used to be an accountant and but now she's just not really making it happen the way that she used to. Okay, let's see, where are we on time? All right, I'm doing okay. Insurance. Whew, there's so much to talk about insurance. I am not going to dive deep um, on this one, but let's just do a quick overview. Medicare typically is for people over 65. You have to pay for it. If you lose it, it's really difficult to get it back. It's extremely challenging to get it back. Um, Parts A and B cover doctors and hospitals and home health and some outpatient services. And then beyond that, there's a ton of letters. I know a great woman named Medicare Dana who has a ton of videos and she's very knowledgeable. And anytime I have a Medicare question, I go to her. Um, One little tidbit that you may not know is if you stay in a hospital for 3 nights, you can qualify for 100 days in a nursing home. That's a good thing to know. If you're in the hospital and they want to discharge you after 2 nights, but you need to go to a nursing home. Medicaid is poverty and children. Generally, you have to divest all of your assets before you can qualify for a Medicaid nursing home bed. Um, you can be on both Medicaid and Medicare if you're over 65 and you have no assets. Um, and then private insurance that we get either through our employer. There is some great private pay insurances that are not part of the exchange. I recently was paying $350 a month for myself and two something for my son. That's through US Health. So for a lot of us who are entrepreneurs and self-employed, some great options there. And then the exchange, of course, The gem of long-term care insurance. These policies are hard to find nowadays, but in the 70s and 80s, they sold a lot of them. And people with long-term care insurance plans, that's great. You have to fight with them quite a bit. You have to go through some possibly embarrassing interviews with them. But after a while, they generally will pay for some caregivers or part of your assisted living fees. So having those policies is really great. We've had our services covered 4 times by long-term care insurance. Okay, buildings. So all of these things I just talked about, hospice, home health, private caregivers, private physicians, these things can all exist within facilities. So you can kind of customize what it is that you need. Just a few things. Independent living is like an apartment, but it is more social because there's other seniors. You go to a meal hall, or I think sometimes you can get the meals delivered to your room, and they offer cleaning and they might offer some little different paid services in addition to the apartment. And they're generally, handicap accessible, et cetera. Assisted livings. There's basically 2 kinds. Assisted living, there's going to be a nurse on staff. It's usually an LVN, not an RN. And they have a bunch of aides. And you might customize, I'm paying for bathing, I'm paying for laundry, I'm paying for med passes. They come and hand you your meds in a pill and a little cup, right? Um, if you are walking through an assisted living and you do not see patients in their rooms with their doors open, that is an independent living that has assisted living services. And a true assisted living, which is more like a nursing home, you should be able to see the patients. It's safe. If they fall, who the aides walking through the hallway, they see that this person is down or having a problem. It's just a safer environment when the doors are open and we know what's going on in there. Um, Nursing homes. There's a range of nursing homes that are quality. Um, I I often think of my hometown in Indiana. There was a place called the County Farm, and if you were poor and old and infirm, you went to the county farm, and that's where you were taken care of by charities and nuns or whatever. Um, the poorest nursing homes with the least amount of funding, Medicaid bed type nursing homes. That is the county farm of our day. If an elderly person cannot take care of themselves at home and they have to go to a nursing home and they're on Medicaid, that's what they will go to. Now, you can go all the way up to this very fancy, very expensive nursing homes. And you pay cash, or you might have some insurance coverage and some cash. Even in a nursing home, recently we were paid to be with a client who was having trouble breathing. He was close to the end, and he would push his button in the nursing home, and he'd have to wait a long time for the nurse. She's busy. She's got 5 or 6 other, well, RNs actually have sometimes up to 40 patients in a nursing home, but depending on the quality of the nursing home, you might get better response. But because he would have to wait, the family really wanted a nurse to be with him. So they actually pay for a private nurse, but you can pay for a private caregiver or a sitter, or the family can sit with the person, just like a hospital. Being with your family member in the hospital is a safer way to go. You've got eyes on them, you know what's happening. ICU, a little bit different story because it's usually one nurse to one patient or one nurse to 2 patients. There's a lot going on in there, and you might kind of be in the nurse's way if it's something really, really critical. Um, Pros and cons of buildings, like I said, social environment. Some people really thrive in that environment, and some people don't like it at all. If you have one parent that has dementia, and one parent that doesn't, I see this a lot. Sometimes the wife will go to memory care and she lives on a locked unit because she wanders. But then the husband lives in the other part, and then he's there with her during the day. So some of these buildings that have assisted and memory care and independent, it's good when both of your parents are alive and you can kind of mix and match what they need. Um, okay, I think that's it for buildings. Okay, and then finally here, um, supplies. I could go deep on this if anybody has any supply questions. But a lot of things you can order on Amazon these days, which is really great. Um, most med or like a medical supply website can get you a lot of the things that you need. But like I said, with insurance, you might qualify for some of these things, hospital bed under hospice for sure. Medical transportation. In Austin, we have a pretty big variety of just from charity groups that drive people to all the way up to actual transport on the stretcher. And we also have a lot of services that will actually come to the home. So we are a little spoiled here. Obviously, you're not going to get that in Wabash, Indiana. Um, okay, home management. I see everything all the way up to house managers that people have that are maintaining the yard and maintaining the home and all the things that go along with your house. And when you're, older, it's difficult for you to get online and order things. And so sometimes people actually have managers of the home. And then finally, financial management. And this is really key if you are dealing with dementia. If somebody starts to have dementia, I highly suggest that you go and get all of your paperwork in order right away because with dementia, people can get very paranoid. They stop trusting their children. They start buying random cars and making really, really bad, unsafe decisions. And then the families, they can't do anything. And there are, if you are in that situation and you know anyone in that situation, this is a good time to go to a care manager. They can find the right kind of doctor that will actually deem them incompetent. They can do a guardianship. They can do a trust through a third party, and that really helps people get out of that particular pickle. It might be a little bit of money up front to an attorney, but could really be worth it in the end. Okay, finally, this is Danielle. She's one of our nurses, and this sweet doggy went to visit one of our clients, which was really awesome because he had pictures of dogs all over his home, his hunting dogs. Um, what is important to you? Do you do you need this treatment? Do you want this treatment? What is your life going to be like if you get the treatment? Is it going to shorten your life? Is it going to make the rest of your life miserable? Would you rather just ride it out and see how it goes? Um, Again, you have the choice, you have the power, you are in control. Um, I put the mountain here because oftentimes we're, we're doing all these things, we're taking care of the UTI, we're getting an X-ray, we're getting labs, we're just fighting like a huge battle, and we're like getting up the steepest part of the mountain. And then when it's time to withdraw, it's so hard to not like, oh, I should be doing something about this. Oh, I need to be doing something about that. No, we're at the point where, in fact, to limit pain and suffering, we want them to decline quickly so that they aren't suffering anymore. And so there really is kind of a peak, especially with end of life. And so it's kind of a shock when you get over the edge of the mountain because at that point, you just are doing what is best for them, what makes them happy. It's music, comfort, friends, videos, pain meds, symptom management, getting hospice involved. We're not your doctor. You might have an amazing doctor that can manage that all himself. So I think that is all. This is me having bathed and got my hair done by somebody else.
Thank you so much, Jessie. That was
Yes.
great. And before I open it up, I did just have some questions, Jessie, that I think would be good to capture on the video, and I imagine most people want to know. For most of us who I assume have not used these services, just to get an idea, what are typical ranges for like if you were to pay friends and family versus maybe a CNA versus an actual nurse? Like what types of price ranges are typically reasonable? And I'm sure it varies, but just to get a sense.
Oh, thank you. I did kind of gloss over that. Let me see if I can go back to that particular slide. Okay. The lowest tier of paid is usually a private caregiver. Like I said, depending on where you are and what people are getting paid in that area, you might be able to find a high school girl that wants to be a nurse and, she'll take $15 an hour. Your niece wants to do it for you. Um, this typically around here, 20 to 40, 20 to $50 an hour, even for a really high quality caregiver that has a lot of experience and they're educated and they understand healthcare pretty well. Um, Caregivers typically want a 4 hour block of time. A lot of seniors are like, I just need somebody to come and give me a bath. And so in those situations, if it's only going to be an hour, the cost of a nurse for us is the same price as a caregiver for 4 hours. So do you want a skilled person for 1 hour or do you want an unskilled person for 4 hours? What could they be doing? Could they be cleaning, cooking, doing some other tasks that need to be done? Maximize the time when they're there. I get a lot of seniors complaining that they just sit here and they're on their phone. But last week you fell outside in the yard and you were there for 5 hours. So I need you to be safe, mom. I'm sorry. Like you're gonna have to deal with this person in your house. That's a lot of times where I'll use a baby camera, and then the caregiver can be in the other room and kind of give them their privacy. Agency caregivers, about the same price. And like I said, one you're the employer, one the agency is the employer. One's regulated, one's unregulated. Care managers, I'm seeing the price in Austin around 175 an hour. Depending on the quality of the care manager, that might vary and depending on where you live. Private nursing, we charge 135 an hour. I've had patients tell me that agencies quoted them up to $300 an hour, which I thought was highway robbery. But you personally could find a nurse. If you personally paid that nurse, the reason I suggest the reason we're a good for that is because we can hire teams of nurses. We have 40 nurses. So if you quickly need 24/7 care, I've got a whole bunch of people to bring in. Also, if you're a private nurse and you work for a client and they pass away, you've lost your job. So there aren't a lot of just private, they need insurance, they need steady work. And so it is difficult to just be an individual private nurse for a family unless you're retired or, you just don't need you just work part-time or something.
Got it. And along those lines, if you do go the higher tier with the private nurse, or maybe even with like a agency caregiver, are there any things that you would recommend asking? Like, I don't know if there are certain certifications or asking for their
Mhm.
insurance or things that families should keep in mind when looking at these
Mhm.
agencies and or private nursing options.
Yes, I would, if you're going to hire a private caregiver, have they worked in a nursing home? Have they worked in a hospital? There are just some basic things that you need to know about perinatal hygiene and medications. And um, so somebody that's worked in an actual facility where they received a bunch of training is good. I like to ask them if they're CPR certified, especially if this person has a full code. How would they handle an emergency? Have they ever been in an emergency? Have they been with dying people before? It's its own experience. Um, and same with nurses, maybe you want to hire a cardiac nurse because you're dealing with congestive heart failure. Um, Kind of tailor that. And then again, going to somebody like Veronica or me, maybe just for a short amount of money to help you with the actual hiring, so that you're not just out there in the dark finding people on care.com. Thanks.
Jessie, thank you so much for all of that great insight. That was super helpful. I know I learned a lot, and I appreciate you taking the time to walk us through that. For those of you tuning in, thank you for joining us. If this was helpful, please like and subscribe. That really helps us out.